Hi, my name is Beth Huston. I am the Director of Sales here at 21st Century Healthcare Consultants, and I am here today to share with you the differences in the non-medical agencies. There are basically two types of agency. One is companion care. I truly enjoy companion care because it provides some kind of entertainment for the elderly as well as socialization skills for those clients of yours. The nice thing about that is you're able to provide services of light housekeeping, light cooking, taking them to and from doctors or appointments, as well as assisting them with, scheduling things with family, things to do during the day. You could even do medication reminders under a companion care agency. Okay? Now, non-medical, as we like to refer to sometimes as personal care. Now you get to do CNA home health aid services. Now you get to include the bathing, grooming, touching of your clients. So both agencies serve great purposes. In some states, you're able to do both services, especially when you do a non-medical agency or personal care agency. You provide both companion care services as well as aid services. If you are strictly a companion care agency, there is no touching of the patient. With certification, when you're a caregiver for a companion care agency, it is nice to have healthcare experience on your resume of assisting, even grandparents or loved ones. But when you get to a non-medical agency, usually depending on your state, the state requires usually at least 40 hours of training and certification for those home health aid. Also, when you are going to open your agency, you're going to require to have liability insurance to protect yourself as well as your business. Also, different states have different time frames as far as the license process. Some states are unlicensed, some are just a few months, and some actually can be as long as a year. So that's why I truly enjoy personal care services. You get to work very, very closely with your clients and spend time with them. Sometimes it's 3 times a week. Sometimes it's a daily needed, depending on what the family requires of you. But you really get a chance to develop a relationship with your clients and your patients. In terms of reimbursement for non-medical agencies, there are a couple states that offer Medicaid reimbursement to companion care agencies. But the majority of reimbursement for Medicaid waivers and MCOs, which are managed care insurances through Medicaid that you'll be able to enroll in, are for personal care or non-medical agencies. You'll also be able to receive private pay, long-term health insurance as reimbursement, and there's veterans programs you can participate in some states as well. Please remember that reimbursement is different for each and every state. With a non-medical agency, you may not participate in Medicare. Only skilled agencies, a Medicare skilled agency, may get reimbursement by Medicare. So if you're looking to do Medicare, you would have to incorporate a skilled agency, and you could buy policies for a non-medical agency at that point. In some states, it is required that an RN is necessary in order to service your clients. That RN's job is to be paid on an hourly basis to go out and do the initial assessment of your patients. And that is required in certain states, not in all states. Once again, every state has different rules and regulations that you must follow, and that is what we are here for. In some given states, you may start with a companion care agency and work your way to a non-medical agency or a personal care agency. Some states only allow you to do non-medical or personal care agencies to initially start. So each state, once again, differs.